with the Meet the Makers series is to offer our community access to those who have created products specifically for people with swallowing disorders. This series is not meant to be promotional, but rather informational and educational. We want to give you the opportunity to ask the creators of these products your questions, learn more about how these products can help people with swallowing difficulties, and make connections so that your voices feel appreciated among our industry partners. We thank you for joining us this evening, and we hope this series is helpful. The makers in this series are volunteering their time to share this information. They have not paid to participate in this series, nor was it required that they be a past or current financial sponsor of the foundation. Briefly, before we begin, I want to thank those of you who joined us for Dysphagia Awareness Month throughout the month of June. If you did not have a chance to become a member of the NFOSD, I would encourage you to scan the code here and become a member today. As a nonprofit organization, we rely on the generous financial sponsorship and community memberships, and we appreciate everything that you can give. Thank you. If you have participated in an NFOSD webinar previously, you are likely familiar with our system. You will be muted throughout this presentation, but are encouraged to ask questions at any point during the presentation using that question box. There are 30 minutes reserved for questions, so please don't be shy about asking. PatCom is generously covering the costs of providing the ASHA CEUs for this evening's broadcast. And for those of you who are joining who are interested in receiving the ASHA CEUs for your participation, you must attend the entirety of this live broadcast and complete the post-webinar survey by July 9th. If you are not interested in ASHA CEUs, there is an option to request a certificate of participation in the post-webinar survey. This webinar will be recorded and available on demand in the coming days. However, ASHA CEUs will not be available for the recording. I want to provide a reminder that tonight's broadcast is for informational and educational purposes. Both the NFOSD and tonight's speakers do not intend to provide any diagnostic or treatment advice or recommendations. If you need assistance identifying a swallowing specialist, please feel free to reach out to us via email. And now it is my pleasure to introduce the team from PatCom Medical, Shelby Farwig, Katie Decker, and Savannah Moore. I will allow them to further introduce themselves, but want to thank each of you for volunteering your time this evening to share more about what PatCom offers to the dysphagia community. And with that, I will turn this over to you. Give me just 1 second here to allow Savannah here to share her screen. Excellent. All right. And Savannah, you should be able to share your screen now.
Perfect. Shelby, do you want to do any introductions before I share?
Yeah. I'll go ahead and introduce the team here. So my name is Shelby Farwig. I'm the Director of Clinical Operations for PatCom. I'm also a speech pathologist, and I have my team, Savannah and Katie, here. They are both speech pathologists as well and clinical specialists for PatCom Medical. So we are going to be separating out a couple sections of this presentation and taking a dive at some of the products and also the reason and the information of why we developed these products. So Savannah's going to be sharing her screen and we'll dive in a bit more. We do, all three of us, have a variety of experiences prior to jumping to PatCom, myself being in acute rehab, mostly a little bit of outpatient. Savannah is with SNFs, and Katie owned her own mobile fees business and has prior experience to that, but owned a really successful mobile fees business. So we have a variety of experiences when it comes to dysphagia.
Go ahead and share my screen and we'll get the presentation.
Yep.
Here. Okay, can everybody see this?
We're good.
Okay, great.
All right. Yeah, so if you want to go ahead, Savannah, we're gonna do the basic disclosure part here. We do receive a salary from PatCom Medical along with the disclosures that Elizabeth mentioned. We are not receiving compensation from the NFOSD. And then yes, we will be discussing PatCom related products, but we're happy to answer any questions from an experience basis. If there's other products or things that you know that are similar in comparison, we're happy to provide some information as well. So PatCom Medical, who are we? PatCom Medical was founded for speech pathologists and really to focus on all things dysphagia. We've expanded a little bit to kind of go into all things pharynx, larynx, and esophagus, but PatCom Medical was originally founded for patient comfort. So taking procedures that are already being completed and making them more comfortable for the patient. So PatCom actually stands for patient comfort, just put together. A lot of our goals and our mission, or anytime we are thinking about new products or new innovations, our goal is the patient and what can make things more comfortable for the patient when there's already a high stress situation of being in a hospital, being in a SNF, being in even going to outpatient therapy. There's anxiety around that and stressful situations. So how can we make common procedures or things that SLPs are doing on the regular just better for patients? So that's our primary focus. That's our goal. We hire speech pathologists because we want the speech pathologist experience when we come up with products, when we are training customers on products. That is just a huge goal of ours. And why do we do what we do? I kind of mentioned this, but we were founded to provide clinicians and practitioners with technology at competitive pricing. We know that not everybody has the same budget as far as capital budget concerns go within a hospital setting or within a skilled nursing facility. So being able to provide technology at competitive pricing so that more people have access to technology that they can use with their patients. That's why we do what we do. And then we're built on that foundation of patient comfort for procedures involving the pharynx, the larynx, and the esophagus. And we're going to go into some of those products and the kind of the reason we developed them, how we came up with that, and then what they do. But this is a little overview of why and the reason we do it. So our products, we've got a long list of them, but we're going to break it down into certain areas. We're going to go over FEES equipment and video stroboscopy equipment. Savannah's going to be taking that, talking about FEES, talking about video stroboscopy, and some of the equipment that goes along with it. Katie's going to be talking about Gloop, our pill swallow gel. And then I'll wrap us up with talking about the PatCom introducer and some accessory products and how we came to have those accessory products. We welcome any feedback. A lot of these products were developed because of SLP feedback and things, hey, we need this in our field. Great, let's see if we can come up with something. So we value that feedback. If you have any ideas of all things dysphagia that would make your lives easier as speech pathologists, as patients, as caregivers, we welcome that at the end to provide that feedback to us as we continue to build our products and help you all out. All right, I'll turn it over to Savannah. She's going to be talking about FEES equipment and strobe equipment.
Yep, thanks, Shelby. So like Shelby mentioned, here at PatCom, patient comfort is at the forefront of everything we do. So of course, our equipment is designed with this in mind as well. So when we think about just about having the right tools, it's about having tools that are designed with the patient's comfort in mind. It doesn't just make the experience better for the patient, it helps improve safety and overall outcomes. So here at PatCom, we offer smaller scope diameters, flexible portable systems with really efficient workflows that help bring dysphagia services to more settings like the bedside, home health, rural clinics, and more. Access to portable and easy to use technology can reduce unnecessary hospitalization and delays in care. So we're really proud to offer very portable systems that can be used at your fingertips. So as we just talked about, having equipment that's portable, flexible, and comfortable for the patient helps us deliver care in more places more efficiently. But beyond comfort and access, we also need to make sure we are presenting a clear, accurate picture of what is actually happening during the real time of a swallow. So that brings us to the next point. You can't treat what you can't see. So clinical or bedside swallow evaluations, it's a great starting point, but it definitely has limitations, especially when it comes to things like silent aspiration or issues during the pharyngeal phase. These are problems that we can't detect without being able to actually visualize it. So that's where FEES comes in. With FEES, we're actually able to see what's happening in real time. We can assess secretion management, airway protection, bolus flow, residue, even tissues and structures of the larynx and the pharynx. And this direct visualization allows us to test certain strategies on the spot, document more precisely, and tailor the treatment to the individual and what is actually happening. So now that we've talked about why high quality visualization is essential, we're going to take a look at the tools and the resources that we have for you here at PatCom. So starting with our PatCom distal chip endoscope, this scope is best suited for swallowing with FEES and in the ENT field. This is because we have a simple USB plug and play design. It can be used on a variety of platforms and devices without requiring any additional software or processors. And the high definition resolution allows for very superb image quality. It's very lightweight. It's ergonomically designed for SLPs. Overall, just a really great tool to use. Next is our PatCom acute care fee system. This setup is ideal for the hospital setting where everything you need is ready to go at a moment's notice. The cart comes fully equipped, so you're not scrambling for your accessories or adapters. It's all there, designed for fast, efficient use in the acute care setting. And lastly, we have our PatCom portable fee system. This can be used with our fiber optic scopes or our distal chip USB scope. And this is perfect for clinicians that are on the move, whether they're seeing patients in long-term care facilities, outpatient or home health systems. No processor, no complex setup, you just plug it in and you're ready to go. So whether you're in a hospital, clinic, or mobile practice, PatCom does have a mobile fees solution to match your setting. So moving forward, when you're performing a fees exam, the quality of the video we capture is everything. It guides what clinical decisions you're making, documentation, and your treatment planning. That's why the specifications of your scope really matter. And it is something that is very easily forgotten when you're choosing scopes, when you're thinking about the technology that you're using. So we're going to walk through a few of the endoscope specifications of our equipment specifically. So first up is the scope diameter. This is the measurement of the outside diameter of the endoscope. Our scopes are 3.2 millimeters in diameter. This smaller diameter means increased patient comfort for sure. These scopes that we offer are borderline pediatric, so very tolerable during an assessment. Next is the resolution. So a higher resolution is just going to have a better image quality. Our distal chip scope does have a true high def resolution of 1280 by 720. Next is the field of view, which is the measurement of the area you can see through an endoscope. A wider field of view helps you see more of the pharynx and the laryngeal structures at once. This is very useful, especially when you're tracking bolus flow or airway protection. Next up, we have depth of field, which is just the distance from the end of the endoscope where you achieve the clearest image. And then the articulation. This is the range of motion of the tip of the endoscope. And this really does make a difference with just how you are passing through the nasal passage and just the range of motion that you have when you're in the pharynx. So now what we're going to do is I'm going to actually plug in my endoscope to the laptop here. Give me just a second. And you guys are all going to be able to see fees and actions. So I'm actually going to scope myself.
And as she does that, I'll kind of add to the articulation or the angulation. I know there's a lot of speech pathologists on here, but for ENTs, that's also very important. For certain angulations, they want to be able to see into the eustachian tubes or in other areas that SLPs might not be assessing. So that angulation portion is very important, and we get questions a lot about angulation and how far a certain scope can angulate. Okay, sorry, Savannah, go ahead.
No, you're good. Are you able to see my camera? Okay.
There may be just a little lag just from, like, if it's a little choppy, that is just the sharing of the screen. I'm going to be talking through this as Savannah goes, so she doesn't have to worry about speaking while she's doing this. So the scope is placed right at the tip of the nose there, and she's going to navigate through. We have 3 channels that you can navigate, and we like to stay low to the floor, just like this. So she's going to navigate. You don't want to go high up there. We want to stay nice and low. And you're going to see her navigate straight back. Right here, we're at the VP port, the velopharyngeal port. So straight ahead of us, if she keeps going straight, she's going to hit the pharyngeal wall. But she's going to use that angulation, and she's going to toggle down just a little bit. And now she's going to go into the pharynx, and she'll navigate into the pharynx. We don't want to hit that structure. That's pretty sensitive. But she's going to get a nice home base right here where she can see the vocal folds. That's the V-shaped structure right there in the middle. She's got arytenoids, which are on top of that. They kind of look like the little dum-dum suckers. That's how I always described them, like little dum-dum suckers. And when she vocalizes, when she starts to speak, you're going to see them come together. So that is the vocal folds coming together, the arytenoids. And then that leaf shape is the epiglottis. She did just swallow there. That leaf shape that covers, that's the epiglottis, and that's going to cover up her larynx as she swallows to protect it in a normal swallow. So yeah, this is the inside. This is what it looks like. We would give the patient things to eat and drink. We would have them do some voicing tasks prior to assess a lot of physiology and things that we may want to look at. Very good, Savannah. You're a pro. All right, so Savannah's going to come on out and she will jump back to the presentation here in just a second.
Like that. Here we go.
All right, awesome.
All right, thanks for that, Shelby. I appreciate your help, so I didn't have to try to multitask there.
There you go.
All right, so next we're going to go into stroboscopy. So this is a very powerful tool that we use for voice assessment. Video stroboscopy uses a strobe light to give the illusion of slow motion vocal fold movement. Since the vocal folds vibrate 100 times per second, we can't see their detailed motion with the naked eye. But with stroboscopy, we can visualize things like the mucosal waves, symmetry, closure patterns, and amplitude. So you might ask, why would we perform a voice assessment using stroboscopy? There's a lot of different reasons. Patients might be experiencing hoarseness, vocal fatigue, pitch changes, breathiness, or other voice complaints. It's very commonly used for professional voice users like singers, teachers, or speakers. Stroboscopy helps us identify the underlying issues like vocal fold nodules, polyps, paralysis, or even tension patterns during speech. So we've talked about the tools. We can either use flexible or rigid endoscopes for video stroboscopy. Rigid endoscopes, it's actually inserted through the mouth and provides a high resolution, stable view of the vocal folds. This option gives you like a crystal clear image. It's very ideal if image quality is your top priority, but it does limit the patient's ability to speak naturally because the mouth is occupied. So you might only get sustained vowels or simple phonation tasks with a rigid scope. A flexible scope, on the other hand, is passed through the nose, just like you saw, down to the pharynx. This allows for a more natural view of connected speech and singing, and to a patient. This is especially helpful if a patient can't tolerate a rigid scope that might need a stroboscopy done. Both have their places. It really just depends on the goal that you're wanting to utilize during your assessment. So now what we're going to take a look at is actually an example of stroboscopy.
And I think these are my vocal folds.
They're beautiful, very well hydrated. So you can see how it's slowing down the all of the mucosal waves of the vocal folds. You weren't able to see this during the FEES video.
Stay low like that. Good. Again like that.
Awesome. Yep. There we go. Awesome. So that was a quick look at our FEES and stroboscopy equipment. Now I'll go ahead and pass it on to my colleague Katie, who's going to be discussing GLOOP with us.
Yeah, thank you, Savannah. So I'm going to talk a little bit about medication intake problems, or MIP, and some solutions that we have for that. So medication intake problems, or pill dysphagia, over the research impacts about 40% of the population. Rates do go higher in the skilled nursing facilities, just because those people, generally are a little bit older or have some medical conditions that could impact their swallowing. The reason behind the medication intake problems is varied. It can be neurological, so maybe after a stroke or a head injury. It can be anatomical, so if there are differences after maybe head and neck cancer, or just the patient specific. And it can be psychological as well, and so you can just have like a fear of swallowing the pills. Maybe you've had a choking incident in the past and now you are very anxious about taking those medications. So we have common mitigation strategies that we use, and maybe some of the patients and caregivers on here are familiar with them. I know the speech pathologists definitely are. But these mitigation strategies themselves can cause a lot of problems. So fruit juice and applesauce can result in a massive under or overdose of the medication. So that impacts the way that those medications are absorbed into the body. Yogurt and pudding can really impact the absorption and lower that absorption rate. It's also not very sticky, and so we see a lot of times those medications sticking either in the pharynx or the esophagus or both. Crushing medications, that changes how those medications are absorbed as well. So when you crush something, usually they're absorbed much more quickly in the stomach. And then thickened liquids, those can also really impact certain classes of drugs or certain medications. And so a better solution is needed because not everybody can take their pills whole with water. We know that. And so that's why we have partnered with Gloop. So Gloop is the first purpose-designed product for the intake of medication. So the whole reason behind Gloop is just for taking your pills. It is a medical device, so it is not a food. It's a slippery algae-based gel that encapsulates the medications to help them basically slide down much easier than with any kind of food vehicle. There are no known drug interactions with Gloop because Gloop has been shown to be bioequivalent to water. And so that means in testing, when you are taking a medication with the Gloop and you are taking that medication with water, there is no difference in the absorption or the effectiveness or anything with that medication. Gloop is also broken down in the stomach immediately, so there's nothing left from it, like pudding, yogurt, applesauce, that's going to be left in the stomach for digestion, where this is just broken down immediately. So we just have an example video here of someone taking a crushed medication with Gloop. So Gloop can be used with both whole and crushed tablets, and you'll be able to see how that medication is just encapsulated in that gel. You can see how it's sliding down into the pharynx pretty easily. It also is going to help with the taste of that medication. And now after this person has swallowed, you can see the Gloop and the entire medication are gone out of the pharynx. Gloop also helps with oral health. So one, it doesn't allow for residue to stay in the mouth, and it also promotes saliva production. And so that can help your oral health. It's 100% natural. It comes in 4 different flavors. Currently, we are offering 2 in the United States. So that would be the vanilla, which is an ITSE level 4 or a pudding thick, and then the raspberry, Gloop Zero, so that is sugar-free, and that is an ITSE level 3 or honey thick. Just a few cool things about Gloop is that it's good for a long time. After you open it, it's good for 2 months. You don't have to refrigerate it, so you can keep it on your counter right by your pill box. You can keep it on the med cart, whether you're in the hospital or skilled nursing facilities. You can put it in the fridge if you would like, if that cold temperature helps with swallowing, or if you want to thicken a level 3 to a level 4. And it is affordable. It's shown to be cheaper than using applesauce or pudding for intake of medications, and it's a measured pump, so you get exactly the amount that you need every time. So just real quick before we move on to the introducer, if you would like to learn more about medication intake problems and medication interactions, we do offer a free webinar. You can go to pillswallowgel.com and just register for that, and we would be happy to talk about this in much deeper detail. So I'll turn it back over to Shelby here, and she'll talk about our introducer.
Yeah, that webinar is great. It does go into much more detail as far as those specific medication interactions and those different drug classes and their interactions with those vehicles that Katie talked about, like yogurt, pudding, applesauce, etc. So feel free to take that webinar for even more CE credit. If you want more CE credit, you can take that webinar. So now we're going to jump to a product that brings us a lot of passion. We get excited talking about this product because of the reason behind it. So we are going to move to the PatCom introducer. This product was developed it was actually PatCom's first product back in 2018. And with the pandemic and things like that, it didn't take off for obvious reasons. There was much bigger things at play there. But the PatCom introducer came from the CEO of the company had volunteered himself to participate in pharyngeal manometry placement. And it was a pretty awful experience. He had, things going into the trachea, he was coughing, he was gagging, and he thought there had to be a better way. So the introducer has now evolved from just pharyngeal manometry to also being used with NG tubes. So this is where we get really passionate because NG tube placements or any type of tube or catheter placement in a patient's medical stay is very common. Millions of NG tubes are placed every year, and the rates of misplacement, so even though the percentage 1 to 3% seems so small, out of millions, 1 to 3% is a large amount of misplacements. And within those misplacements, up to 40% of those cases result in harm for that patient. And it can result in many different things. Pneumothorax, a very severe thing, perforations. We see here this example, this is actually an example from one of our European colleagues, but a misplacement right into the airway. You can see the secretion management isn't ideal for this patient. And so the NG tube is straight in the trachea. So the PatCom introducer allows for a combination of use with your endoscope and the introducer to be able to visualize your way into the esophagus for feeding tubes and different catheters up to 14 French directly into the esophagus. All right. So like I mentioned, you use the visualization capabilities from your endoscope for transnasal navigation into the esophagus. So basically what happens, here's kind of 4 steps that happen. But you take your endoscope and you take an introducer, you slide the introducer onto your endoscope, and you're gonna scope the patient like you normally would for a FEES exam or any endoscopy. You're gonna go through the nose into the pharynx, and the last step is going to be navigating to the opening or the UES. So right toward the UES. If the patient can swallow, you're gonna have them swallow, which is gonna relax the UES, and you're going to navigate into the esophagus because you can see and visualize where you're going. The cone here at the tip of the introducer, there's a small cone, and that's actually going to sit right at the patient's nose here. So as soon as we have that in place, we're going to extract our endoscope, and now we have an open channel for a catheter or a tube to be fed straight through and not questioning where that goes because we know it's already in the esophagus. The introducer then is disposable. It pulls apart. So we have a second set of hands that will hold the tube or catheter that has been placed in, they'll hold it kind of steady while the other person pulls apart the introducer and then disposes of the introducer. We have 3 different sizes currently, and it's based on the inner diameter. So we have a 4, a 5, and a 5.5. Those are based on different measurements of your scopes, but also the tube or catheter that will be placed through the introducer. We do have introducer courses. We come on site, we do trainings with a lot of hospitals and facilities, and we do have a CE course available that we can do on site for your facility if this is something you would like to learn more about and to implement at your specific facility. We have SLPs doing it, we have nurses doing this, and yeah, it's going really well. We have a lot of really awesome feedback from patients as far as reducing the number of times that they have to have something go through their nose for a procedure. Other common methods of verification of placement are, there's different products out there, like CoreTrack is a good example. It has a sensor and it picks up and it kind of shows on a quadrant where the tube or the catheter is being placed. There's fluoro-guided placements. There's NG tubes that have actual cameras on them. They don't have any angulation, so you still are just feeding, but you can at least see where you're going. So there's a lot of different tools out there. The introducer is a cost-effective one because it's disposable and it already utilizes the technology of a scope that we have in a lot of our medical settings. All right, we're gonna watch some cool videos here. So let's do the one on the right first, Savannah. This is gonna show just a verification that a tube, this is the CEO here, he's going in the other nostril, and he's gonna take a look to make sure that an NG is placed properly. So you'll see there, this is after we use the introducer, you can see there it is. That's what we want it to look like. So in comparison to the previous image that we saw on the other slide, this is what we want it to look like. And then this live view here, and then Savannah, can you kind of slide it forward till we get into the pharynx a little bit? Yeah, there's kind of a lot of fluff there in the middle. So we'll slide it forward till we get, yeah, there we go. And you're gonna see the patient swallows, and then we're gonna navigate toward the, kind of along the posterior pharyngeal wall. And once we get there, yeah, it's a little bit further, that's okay. There we go. So, yep, you can see right here, she's gonna navigate right toward the UES back here, and the patient's gonna swallow. And there it opens up. So you're gonna see, oh, there's a lot of liquid. This is the patient swallowing water. And you will see things open up here in just a little bit. As soon as we'll be able to see inside of her esophagus here in just a second. There it is. We get a good view here in just a minute. And
Lots of swallows happening.
Lots of swallows. Yeah, that's a lot of liquid. There it is. So that's the inside of her esophagus. So that's where we would then go ahead. You can stop it, Savannah. We would pull the scope out.
Actually, see it a little bit on this video right here.
Oh, yeah,
and you
there
can
we go.
see the scope coming out.
The scope's coming out, and then that's when we would feed that channel directly behind it. Okay, awesome. So yeah, so that's kind of what the process looks like. It's an awesome procedure. It's not even its own procedure, a new procedure. We're just utilizing a technology to advance a little bit further so that we have open access. So yeah, and then we'll move on from that. So these are some accessory products for all things dysphagia. A lot of these were driven by patient and customer feedback. The one being the Scope Mate. The Scope Mate was developed because people were, once a scope is pulled out of a patient at the bedside, a lot of times in the hospital setting, they're transferring them in biohazard bins down to sterile processing, which is a perfectly normal process. But a lot of people don't take them to SPD sometimes. Sometimes they do their own cleaning, or they need a way to transport a dirty scope while keeping the scope protected and not in a big clunky bin that they're going to carry across facilities or across. So the PatCom Scope Mate actually fits around endoscopes, and it wraps around the handle, and they're disposable. So it's basically a tube or a protectant for your scope so you don't get biohazard material touching any other surfaces while transporting your scope. The next is going to be the head model, a cost-effective head model for student use and training purposes, and then the endoscope holder, another name, cleaning tube for portable cleaning solutions on the go, to be able to use your high-level disinfectant on the go, to be able to seal it up and take it and travel with it. We developed that based on customer feedback as well. So we're open to a ton of products. If you have any ideas, feel free to share those with us. But we'll go ahead and jump to the next slide. Yes, so quick acknowledgements before we open it up to questions. Thank you to Ed and Elizabeth and the NFOSD just for supporting patients, supporting SLPs, people treating and living with dysphagia. We appreciate all you do for the SLP community and the patients. So thank you for having us. But we do have some questions already in the chat, so we will jump to those. Let me jump up here. I'm gonna just go from the top down here. So does your company contract with SNFs to provide an SLP with FEES equipment? So we do work with a lot of SNFs to help you start building a FEES program within your facility. We also help provide equipment to mobile FEES providers. Anyone who wants equipment, we can help you with that. I'm not sure if that's exactly we don't provide FEES services ourselves, so we're not contracting. I'm not sure if you want to clarify if that's what you meant or not. But that's what I took from that question. Yes, so do you have evidence-based research for the Gloop gel? You can email over for review. Yes, and we go into a lot of that in the webinar that we also offer as well. So we're happy to provide some resources, but those are in our webinar that we do, the free webinar. Do you need a prescription to use Gloop? No, it's a medical device, but not anything prescription. You can buy it over the counter. Patients can buy it from our website as well. Yep, we can share the ingredients. Katie, do you mind pulling up some of the ingredients for Gloop?
Yeah.
While I run through some more of these questions, yes, we can share. Water is the first ingredient for sure. It is Are samples of gloop available? So one way for speech pathologists, taking our webinar, you do get a free bottle of gloop that you can sample with your patients. And then if you have a patient who is wanting to sample it, we can offer them 50% off their first bottle to be able to try it at home. So those are the ways that we're doing samples. We do have the packaging in the bottles are made, because it's a medical device, they are made to not uptake anything from the environment. So as far as harvesting bacteria or viruses inside the bottle, the pump is made to expel only. So that is a way as far as sampling goes to make sure you're not cross-contaminating between patients. Let's see here.
Yeah, so I have the bottle of Gloop here with me. This is our Gloop Forte. So ingredients, water, glucose syrup, sucrose, so that's just to add that flavor, maltodextrin just to thicken it up, carrageenan to add as a thickener to keep that together until you swallow it, a natural preservative, and then some natural flavors and aromas.
Mm-hmm.
So it's all natural, everything. The Gloop Zero has a plant-based sweetener in it. So it's not one of like an artificial sweetener that some people are sensitive to or worry about. But that would have the same ingredients in it. And we're happy to send a full list to anyone that would be interested in that.
Okay, this is the most common question we get about the introducer. Would the SLP bill for inserting the introducer? How does reimbursement work? That's a great question. So a lot of our SLPs that are using the introducer, it depends on your facility, but a lot of people that are using the introducer are using it with fees. So they have a list of their patients that they are going to do fees, and their tube team or their nurses also have orders for an NG tube placement or some type of catheter placement. So they are collaborating. This is promoting interdisciplinary collaboration between the two, and they're able to kind of meet that patient early. And I'm thinking of the number of patients that I had where I went in to do a fees and they just got an NG tube placed. And so we could have actually eliminated the number of times that the patient had to be scoped or something put through their nose by just collaborating a little earlier. And I could have done my fees with the introducer, and then the patient wouldn't have had to have blind placement attempts because the introducer would have been there. So if that's the case, you're billing for the fees. You're not, the introducer is not a procedure. It's a tool. It's a tool that is used with your fees, or if you're doing pharyngeal manometry, it's used with your pharyngeal manometry. If it's used with, if a nurse is using it, it's used with her NG tube placement. So yeah, it's not a separate procedure. There's no CPT code for the introducer. It is navigating into the esophagus. So hopefully that answers your question there. We do have some facilities that have it listed as an inventory item that they can scan and bill the patient for the product itself utilized. Placing the is in the scope of practice for SLPs. So yeah, that's up for interpretation. And Katie and Savannah, feel free to jump in on this as far as scope of practice goes. But we have SLPs doing TEPs. We have SLPs doing pharyngeal manometry, which is navigating into the esophagus. So there are procedures already out there that are the SLP is taking advantage of and doing. And personally, I think we need a bigger role in the esophagus. And so this is a method where we are using a tool that we're already competent in doing as far as navigating into the pharynx. We're just going this much further.
And I do want to point that we are not placing the feeding tubes.
Yes.
Nursing or the tube team, whoever at the facility that would normally place those NG tubes, that is what we're doing. We are just doing the setup for them before that, you know, and then we're not saying that there doesn't need to be any verification that it's in place correctly in the stomach. We are just going up here to make that more comfortable, to make that a lot safer for patients.
Right.
Yeah. It's just an access. So we're not doing a new procedure. We're not going and doing an upper endoscopy. It is truly an access point. And we're doing essentially the same thing that a nurse would be doing with the patient, although we're allowing for visualization for it.
Yeah. What I was gonna add one other thing. And now I forget because I read the next question. This is a very, very good point. The next point is, while training of SNF and hospital staff is welcome, I have significant concerns regarding the significant staffing shortages in these facilities and its impact on having well-trained and experienced staff to manage the PatCom introducer. The potential for litigation as a result of improper product implementation is high. Yeah, I certainly think this is a trained skill. So as far as someone doing this, the IFU for the introducer says a trained medical professional. It does not say that an SLP is the only person that can utilize the introducer. We've had a lot of nursing reach out to us and say, yeah, can I use a scope? Why couldn't I use a scope? Just to visualize. I'm not doing fees. I'm not taking over the SLP's role of doing dysphagia diagnostics. I just want to use a scope so I don't have to go in blindly. They don't like to place tubes blindly as much as we like seeing them place tubes blindly. So that is one thing. And yeah, I agree with you. With the current healthcare climate, I foresee that being an issue. We don't want to train anybody on using the introducer who is not competent in fees and is competent at doing fees regularly. So that is kind of where we stand on that, but I definitely agree with you that this could be, yeah, could be tricky if you don't have trained people and staffing there are staffing shortages in the healthcare environment. Do you recommend use of lubricant or anti-fog for fees with your equipment? Yep, you can use it. It's not required, but you can certainly. Water-based lubricant would be the one that I would use first, starting with a water-based lubricant if you need to. What is the cost of it if we order it from Pakistan? I'm happy to answer that maybe individually if that's okay. I'm not quite sure off the top of my head what we would do for Pakistan. So, and then Elizabeth, if you don't mind, can we reach out separately and get them that information?
Absolutely. I'll give you their contact.
Okay, perfect. Yeah, we'll reach out to you separately and get that information to you. Do you provide fees training? We ourselves do not, but we do partner with a lot of people. We know a lot of trainers, and there's a lot of amazing fees educators out there. So if you have questions on courses to take, there's so many amazing. We don't have any negative feedback about any courses that we've ever participated or assisted at. We do take equipment to quite a few courses to have extra systems there and just to be able to show our equipment at some of those courses. But yeah, if you have specific questions about courses, yeah, but we ourselves do not provide the fees training.
We can actually loop in the cost of, like, if you have a bigger team that's needing training, if you're purchasing equipment through PatCom, we can bundle in the cost of a fees course and competency training if that's something that makes it a little bit easier for your facility.
Mm-hmm. Yeah, this next question is great. Does Gloop have food coloring product for fees? Not yet. We are working on it. So we are going to be having Gloop fees. It will be dyed green, but it will be translucent. So you can see the whole tablet that you're testing. You can see it, the entirety of the tablet through the Gloop. So if you currently use things on your fees like applesauce, pudding, whatever you use, you kind of miss part of the tablet because it's covered by whatever vehicle you're utilizing. Where Gloop fees will be that translucent, so you can see the entire tablet. It will be lemon flavored.
Yeah, and the color that you saw in the video, the Gloop example video that we showed, it'll be a lot like that.
Mm-hmm. Yep. Let's see here. Yes, so can we get the material? I'm assuming that's for Gloop as far as resources. Yes, we can provide that. Is Gloop available in Pakistan? We are only the distributor of Gloop in the US. So we cannot distribute to Pakistan, unfortunately. We can connect you with the European group that might be able to. I'm not quite sure exactly how that would work, but maybe, but not us specifically, sorry. Is Gloop available in Canada? Not yet. We are working on that as well. So we're hopeful that we will become the Canadian distributor as well. We are working on that very, very hard. So hopeful in the near future to have the Canadian distribution rights for Gloop, and it will be the same product line as well. Let's see here. Yes, can we use Gloop with diabetic patients? Yes, Katie talked about Gloop Zero, which is the plant-based sweetener. So it's sugar-free. It's sweetened with xylitol from a birch tree. So it does, for patients with diabetes, help with that. Okay. how does one go about getting Gloop into hospitals? Are there discounts for larger orders? Yes, we most likely would do a contract as far as with your supply or your shipping. Probably the best person to start would be a materials management. They have different titles in different facilities. Maybe a nurse educator would be first. So getting a nurse educator on your team to kind of explain what it is. We do on-site trainings as well. So if you have nurse educators, any management that want to learn about it, other SLPs, we can come on site and do kind of a little in-service or a demo or a webinar basically, but for your staff on site. But then the nurse educator would be the first person I would kind of get a champion for on your team. And then the materials management, getting those folks involved because it will need to become a registered product in your ordering system. And then from there, we would most likely build a contract between us and your facility as far as what that bulk pricing, if there's going to be regular shipments or just ordered as needed. There's a lot of factors that go into that, but those are typically the recommendations I would make to get started in the hospital setting. Definitely have a nurse champion because you can buy as much Gloop as you want, but if it's not being used, you're not going to continue to buy it, and the nurses are going to be the ones, nurses and SLPs are going to be the ones utilizing it and advocating for their patients. Are the bottles recyclable or compostable? What is on the bottom, Katie? I forget
They are recyclable. It's a number 1.
Number 1, yeah. Can children use Gloop? Yes, they can. Children above the ages of 2 can use Gloop. Any known Gloop side effects? There are no known drug interactions that are known at this time. And then unless you have a known allergy to any of the ingredients, as far as like maltodextrin or any of those, you could have an allergic reaction to some of those, but outside of that, no known side effects of Gloop. It is bioequivalent. The body treats it like water, so it is bioequivalent to water, and we have studies that show that bioequivalency. Do you know if Gloop has the same effect on the lungs as thickened liquids? That's a great question. The bioequivalent, Katie, and you can jump in, because of the bioequivalency to water, it is going to not be treated the same as a thickened liquid. So Katie, if you have any additional to add to that.
Yeah. So we don't have any specific data, of course. You know, we can't just force people to aspirate Gloop and see what happens, of course. I don't think that would be a very popular research study. But because, like Shelby said, it is bioequivalent, it's not going to have that residue of the thickener. And so the thickener that is in, or what makes Gloop thick, is not the same thickener as thickened liquid. So whether that's a gel-based or a starch-based, it's just not the same because it does break down. It's meant to be thick for a temporary amount of time, and so it's not going to act the same in the lungs.
Mm-hmm. Yeah, that's a great point. So the thickener that's used for Gloop is starts to break down based on body temperature or the certain temperature and pH. So as soon as it reaches that, it's going to start separating or dissipating from the tablet that it's attached to or anything it's attached to. And then the thickness goes away. Okay, are most of the introducer users nursing or speech therapy currently? Currently, SLPs are higher percentage as far as compared to nursing. We've recently explored the nursing option and we've got a lot of good feedback that way. So we do have nurses exploring that option as well. Okay, for someone who has anxiety swallowing pills, would you recommend the yogurt or honey thickness to try? What is the mouthfeel of the products versus a water or yogurt, thick or slippery? Okay, this is all perception. So one, if your speech pathologist has made a recommendation for thickness that you do better with based on instrumentation, that would be where I would start. But if this is more so you are experiencing it yourself, you've never been seen for dysphagia, it's really about preference as far as the honey thick versus the pudding thick. The pudding thick, I think it's easier to swallow in my opinion, because I think it's thicker and it does kind of coat things better. But I don't know, Katie, Savannah, you guys can give feedback. I also don't have trouble swallowing medication, so it's hard for me to give feedback because it's kind of different for me.
Yeah, I would say like the mouthfeel, it definitely feels slippery. Like I've heard a lot of people say it feels like kind of thinner Jello kind of feel. We definitely recommend that you just take the Gloop by itself before putting any kind of tablets or medications in it, so you can kind of feel that in your mouth. To your other part of the question, if it's an adequate mouthful, you can use less or more. You know, you don't have to use just the 5 ml pump. That's just measured basically for convenience, but you can certainly put more or less on there. I'm like Shelby, I like the vanilla flavor better, but that's a personal preference. You know, we have a lot of people that really like the raspberry as well. So yeah, it's just kind of personal preference.
All right, maybe I missed this, but can you please clarify how Gloop is different than putting a pill in moderately thick or extremely thick water or flavored water? It is based on the thickening agent. So thickening agents, and this, we talk about this in our webinar, the common thickening agents that are utilized do have interactions with certain medication classes. So Gloop is a different thickening agent that has no known drug interactions with those particular medications. A good example, and Katie, you can add to this as well, but certain thickeners will basically adhere to the medication longer in the digestive tract. So the medication actually isn't broken down into much farther into the digestive tract. And if that medicine is supposed to be absorbed in that first 30 minutes, you're missing that key time because that thickener is still attached to the medication. Whereas Gloop, the thickening agent, like we talked about, temporary, it's very temporary. And as soon as it touches the stomach contents, it dissipates. And so that tablet is there in the full form right at the absorption when it should be absorbed.
Yeah.
Any guidance on choosing ITSE versus ITSE 4 versus ITSE 3 Gloop? Yeah, kind of just what we said. If you haven't had instrumentation done and a recommendation based on the instrumentation, then it is basically on preference for you. So, and that can be on if you've used other strategies, like if you've used yogurt, if you've used pudding, if you've used like a thicker liquid before, how did that go? And see if you have preferences there. Yep, this is fantastic. Looking forward to seeing it. Great.
The 3, I mean, if flavor isn't a big deal, if the sugar isn't a big deal, which in the Gloop Forte you're not getting much sugar per intake, you can always get the 3 and then put it in the fridge and it will be a 4. So then you can try both.
Yeah, oh, great. Okay, and then does Gloop meet kosher requirements?
So the Gloop Forte does. The Gloop Forte has absolutely 0 animal products in it. And because it's not a food, it doesn't need to be kosher. So it's not actually kosher, but it's not food. So it doesn't need to be kosher. In the Gloop raspberry, the coloring comes from a beetle. And so that's going to be based on how strict you are with your kosher requirements. If that little bit of that colorant from the shell of a beetle would put it out of the kosher category. So.
Is Gloop the same as barium sulfate? No, this is not a barium product. So it's not utilized for modified barium swallows. This is for medication intake outside of instrumentation. So this is for everyday medication intake.
We have seen Gloop used during modified barium swallow studies, like with tablets, like with, that's been really helpful for people to see how it affects the esophageal phase.
Yeah. I noticed that Gloop product on Amazon for $50. Is that your product, and can we get it cheaper through you? So yeah, we do have the Pill Thing is a company on Amazon that is distributing Gloop on Amazon. They are accounting for shipping costs as well. So it's free shipping from them, but the price is more. Ours is cheaper on our website, but there's shipping involved with it. So it's the same roughly. So yeah, you can go through Amazon, you can go through us, either way. Let's see here. Yeah, but for the Gloop, yeah, if you do have patients who want to test it out, we can do the 50% off their first bottle. Just let us know, and they can reach out to us, and we can get them their code for their one 50% off bottle. If you're a speech pathologist wanting to test it out, you can take our webinar to learn more about these medication interactions, and we'll send you a free bottle after that. What is your cost for training Gloop for nurses and SLPs in acute care? Nothing. We can come on site and yeah, kind of do that based on a large group. We like it to be a larger group. If it's just one SLP, we just recommend you taking our webinar because it's going to be very similar information. But if it's a large group and you have admin and you have nursing staff, yeah, we're happy to come on site and we won't charge for that. You had mentioned that the Gloop is bioequivalent to that of water. Does it have an impact on those who could benefit but also have excessive secretions? That's a great question. Again, yeah, let me ask that again. You had mentioned that the Gloop is bioequivalent to that of water. Does it have an impact on those who could benefit but also have excessive secretions?
So that's kind of twofold, right? So if you have excess secretions, it might make it more difficult to swallow pills. You know, that might be more of a challenge for you. So I could see trying out Gloop as a possible solution. Now, the Gloop Zero does have xylitol in it, which is a saliva, it will stimulate saliva production, but it's not going to stimulate it for very long, right? Just kind of while you're taking the Gloop. So it's not going to make that problem worse.
Yeah. I would be interested, you know, things for further studying that I think we are looking into or we want to kind of continue to look into. But what Gloop impacts on residue? I think because it doesn't leave a residue, it'd be interesting to see with secretion management and with, you know, maybe former residue as far as patient has a lot of residue or pharyngeal residue, and then they take Gloop with their medications. Does that help with residue? It'll be interesting to see what, as we continue to look into things, what we can see from that. Okay, does the Gloop encase the medication such that there is less medication taste upon presentation? Yes. So the Gloop Zero, the moderately thick, you actually, with your spoon, you put the tablet on the spoon first or in your med cup, and then you pump the Gloop on top of it and it will encase the medication. With the pudding thick, we actually recommend putting a little bit on the spoon first or in the med cup first, then your medications, and then more on top of it. We just want to make sure that it's fully around the tablet. But yes, it definitely helps with the taste. I have those nasty magnesium and potassium pills that I take. They're awful. I use Gloop with that, and it does help with the taste. Thank you. And then what meds typically have interactions with thickened liquids? We go through that in our webinar. There are different classes of medications. Katie, do you want some of the top ones?
Yeah, so there's 4 different classes of medications, and so 2 of the classes are highly soluble, which means that they break down very quickly. And there's lots of medications that are included in those classes. So a simple one is like a Tylenol, right? So that Tylenol is meant to break down very quickly in the stomach within 30 minutes. The thickened liquid, because it blocks the breakdown of that medication, you're not going to absorb that medication. So in the webinar, we go through lots of different examples of things. There's like beta blockers for high blood pressure. Certain antibiotics can be affected a lot by the thickened liquids, particularly penicillin, and then lots of other, you know, different drugs. So yeah, it's those ones that are meant to be broken down very quickly.
How long does it take to start breaking down? What if your patient orally holds for some time before the swallow? Yeah, it's based on the pH too. So the stomach contents are going to be what really set it off. So as far as any holding or now, if they're like aggressively swishing it back and forth and trying to separate it from the med, like it will separate eventually. But as far as breaking down that thickening agent, it does need the pH of the stomach contents. Let's see here. And if it doesn't break down until the stomach, why don't we use the thickener used to thicken Gloop for drinking liquid? Seems like it would be a good given the similarity to water in the lungs. Yes, you're correct. It's not a food though. That's the problem. This is a medical device, not for food and thickeners. So thickened liquids, the current thickening agents out there are considered foods. You have to go that route as far as when you FDA approval and things like that. There's a lot of different things that go into play there because it is for food. Maybe one day we'll figure that out. Is there a plan to develop individual Gloop samples? So the individual Gloop samples, that there was a previous distributor that had the individual sample packets. The individual Gloop samples, not for sale, because the bottle actually helps with, because the bottle is a part of the medical device. It does keep the product, as far as the consistency, it's IDSI standard. So we have to keep it consistent with that particular, that's how it was made, and that's how it was tested as far as keeping that IDSI standard, is through that pump. So as far as for sale with the individual packets, no, because that pump is a huge part of it. And the patients tend to appreciate the pump more at home, because they can just keep it on their countertop with the with their medications. Now, I know there's been some questions. We get questions a lot about, like, can I take this into patient rooms, like on a med cart, back and forth? And it really is about that bottle and how the bottle is manufactured to be able to take it from room to room. We also have facilities, depending on your stay. I know not every patient has a longer duration of a stay, but because of the cost effectiveness of it, keeping one bottle per patient and just keeping it in the patient's room is also another solution for those patients that are utilizing it during a stay in a SNF, or even acute rehab, or even acute care. If they're taking meds 4 times a day, 3 to 4 times a day, you're going to get use out of a bottle of Gloop in their stay there. Which webinar do SLPs take to receive to receive a sample bottle? Is it another one in addition to this? Yeah, so it's actually on pillswallowgel.com. We can have Elizabeth, or we can, like, is there a way to send out a link to this? Or I guess, can we drop it in here, Katie?
And I can send it out in the email that will go out just a few minutes after this. It's
okay, yeah, we'll put the link.
Right.
Perfect. Yeah, we'll put the link to that webinar for the different medication interactions in there, so you can register for it there, and some of the details for that.
Excellent, thank you. Maybe a couple more questions. I know we have so many questions to get to. You're doing such a wonderful job answering these. If we don't get to your question this evening and you would like it answered, please feel free to reach out to us. You'll have our email address after this webinar, and I can pass the questions along. But if you want to answer a couple more, and then we'll start to wrap things up.
Yeah, the next 2 are great questions, and we didn't actually mention this. You saw in the video, the question is, since Gloop doesn't have any known interactions with meds, does it matter if medications stay whole or are crushed, or just patient preference? They can be crushed as well. So you saw in one of the videos, Gloop with the crushed medications. So you can crush them still if the patient does need that. There is some literature that we have that shows that Gloop can reduce the crushing rate. There was a large skilled nursing facility that was crushing at a high rate, and they implemented Gloop across the spectrum in their facility, and they showed up to a 40% reduction in crushing when implementing Gloop versus things like pudding, applesauce, etc. So yeah, you can still crush.
That too, there are certain medications that can't be crushed, and so you'll want to ask the pharmacist if that's a medication that can be crushed or not.
Right. And then if the product is considered a medical device, is it covered, or patients with Medicare? So it not insurance, but it HSA and FSA covers Gloop. Great questions. Whoa, I think that's all the questions. Did we get to them all?
Nice work, Shelby, Katie, and Savannah. Thank you so much for joining us. Engagement was high. Tons of questions came in with this. What I will do next when we end this, I will send out an email within the next half hour to everyone who joined. There will be a link with a short survey. If you take this survey and you would like ASHA CEUs, fill out those questions. If you would just like a certificate of participation, feel free to fill out those questions and you will get a certificate emailed to you. If you have any questions, reach out to us, and I will put that email link for your webinars in the email that will go out here in the next half hour. And with that, we'll wrap it up. Thank you so much, you guys, for joining us. I appreciate it. And reach out with any questions. Have a great night, you guys.
Thank you.
Thank you.